Okay, we're going to jump right into something that affects every single one of us. But honestly, we probably don't think about it nearly enough, and that's our lung health. So I want to kick things off by asking you a really direct question.
Seriously? Think about that for a second. You feel totally fine. You're not huffing and puffing walking up a flight of stairs. So naturally, you just assume everything's okay in there, right? Well, today we're going to challenge that very idea.
So let's start with our first section here, which I'm calling the health checkup illusion. This is all about that huge gap between what we think our checkups are telling us and what might actually be going on inside our bodies.
Look, we all try to do the responsible thing. We go for our annual physical, we get that full-body checkup, and when the results come back looking good, we breathe this huge sigh of relief. It feels like you've gotten a clean bill of health for everything.
But this is where the problem really comes into focus. On one hand, you have what you see, those normal blood reports, and they're great for checking things like your cholesterol or your kidney function. But on the other hand, you have this massive blind spot, because those same tests tell you absolutely nothing about your lung health.
And that brings us to a really crucial point in our next section, the lungs' silent decline. This is where we're going to uncover why feeling perfectly fine might just be a dangerous illusion when it comes to your respiratory system. And by the time you actually start to feel like something is wrong, a really significant chunk of your lung function could already be gone. The damage can happen so quietly, over years, without you ever even noticing. So you're probably thinking, wait a minute, if my body's being damaged, shouldn't I be getting some kind of signal? It just seems logical, right? But the thing is, our lungs, they work a little differently.
And it really boils down to two main things. First, your lungs have this huge reserve capacity. I mean, think of it like a backup generator. You can lose a good amount of the main power before you even notice the lights flicker. And second, because of that backup system, the symptoms we all associate with lung problems, they only show up very, very late in the game.
All right, so we've kind of laid out the problem, and I know it can sound a little concerning. But now, for the good part, let's talk about the solution in our third section. So the bottom line is this. Those standard checkups, they're just not going to cut it for this. If you want to move from just guessing to actually knowing what's going on with your respiratory health, your lungs need their own set of specialized, targeted tests.
And these are the tools that get the job done. We're talking about specific tests like spirometry, which is all about measuring how much air you can breathe in and out. Then there's impulse oscillometry, which checks for any stiffness in your airways, and something called pheno, which measures inflammation. When you put them together, they create this incredibly precise picture of your lung function, and they can catch problems way, way earlier than symptoms ever could.
So that brings us to our final and, I think, most important section, your proactive lung plan. See, this isn't about being worried. It's about being empowered. So let's look at 3 super simple steps you can take to get in control. So what can you actually do about all this? Well, let's break it down into a really clear action plan. Number 1, understand that those blood reports, they just don't tell the whole story. Number 2, don't wait for symptoms to show up. Be proactive and get your lungs checked. And number 3, the absolute best way to do that is to talk to a respiratory specialist, someone who knows exactly what to look for. You know, at the end of the day, it all comes down to this really simple but powerful idea from Dr. Rahul Sharma, who's an expert in this field. It's an equation. Healthy lungs equals a healthy life. It's just a fundamental truth that we really can't afford to ignore.
So I'll